Hi, I'm so excited for another edition of our superhero podcast. And today I'm so honored to meet Matt. And so I'd love to kick it off with Matt. And Matt, if you could introduce yourself, your job title, how long you've been doing it, would love to get to know you.
My name is Matt Bixby. I'm a cardiac sonographer is the actual title that we have. So some people go by echocardiographer. Um, what was the other part of the question?
How long have you been doing it? So long, we forget.
It's been about 8 years now, actually. About 8 years.
Yeah, and we are so lucky to work with you. As we kicked off kind of before we started recording, I've gotten to know your name and blessed to know you. And I know from your assignments, you're such a rock star and honored to get to meet you in person and put a face with a name. And just thank you for your time today. Well, good. Okay, so
Of course. Thanks for
I guess my
offering it to
first
me.
question will be, what inspired you to become a sonographer? Like, what's the background, your origin story in superhero terms?
See, what inspired me to be a sonographer? Um, you know, a lot of my family's in healthcare. Got some pharmacists, I got some RNs, got someone that does psychology. So I kind of knew healthcare was going to be in the what I wanted to do. I didn't really want to do any kind of real hard labor. Um, and so I knew I just wanted to lean that way and enjoyed it so far. So
It's awesome that your family has made such a difference because that's what, like for me, I think about like my background and I just didn't have healthcare. Family didn't really know much. I didn't stumble into it until becoming a recruiter. So just think it's such a neat profession to make a difference. I feel like as a little kid, you just think doctor, and I didn't know if I could do that.
yeah,
But it's been interesting on our side just to see this so many different paths you can make an impact to patients and be in the hospital without being like neurosurgeon.
yeah.
Well, good. Okay. Well, my next question will be, when was a time you felt like you really made a difference to somebody? I tease within HIPAA regulations, but I know your everyday is a lot harder than typically our everyday, kind of making impact and touching patients' lives. And I didn't know if there was a specific story that stood out where you just really said, okay, this is where I'm supposed to be and I'm making a difference.
Something that I really feel like I've impacted with patients. I don't know if there's a specific um, instance. There's been lots of occasions when I'm working outpatient where I have patients in a wheelchair, not necessarily wheelchair bound, but it's a long distance for them to walk, so it's hard for them to get back out to their vehicle. I'll just wheel them from the fifth floor, if that's where I'm at, all the way out to their vehicle, make sure that they're in their car safely, and if they need something else, I can do that for them as well. So um, found a lot of pathology on people. I've found some pretty big masses in hearts. And I don't want to say that I've saved their life because of that. I'm just someone in the step of the process. In my eye, the surgeon is the one that saves the life, the one that removes the mass. But I guess if I hadn't done the ultrasound of their hearts, they would not have known that that was there. So
That's where I was about to say. I think it's definitely every piece of the puzzle, right, on making an impact. And I know with our own personal health journey, like
absolutely.
understanding the diagnosis of it is just as impactful, right? You've got to figure out what's wrong to be able to treat it. And I absolutely love that you walk them down. I think it's that small human touch, I think is what's so important. And I know too, like being on the patient side, how scared I was of certain things and just really when that someone is just a little bit extra kind and nice, I think in today's world especially, it just makes such an impact. And I thank you. I know it probably feels small to you walking them down, but I would know in my shoes or a family member's shoes, I'd be so grateful for that kind of extra moment of on the other side of it, relief and just being able to connect. So thank you for doing that. Yeah.
Yeah, I get a lot of from the managements and everything. A lot of people compliment me on my patient care skills. So, and I think again that has a lot to do with not only my personality but just growing up around healthcare. So I know how to treat patients for sure. So
Yeah. And you're so fun. We know that. I've gotten to know your name for years, so I know you stand out as just being a little extra fun, and it sure makes a difference to all. And then I guess we'll kick off my last question is like, what made you decide you wanted to travel? We tease take your superpowers on the road. What kind of had you jump into the world of travel?
what made me to become a traveler? Um, when I was a student learning to do my job, um, we had several travelers come in, and I kind of learned what their lives were about, how much freedom they had, all the places they got to visit, of course, the money that's made or potentially made as well. Um, and for as adventurous as I am, I hike as often as I can. I do a lot of landscape photography, so being out and about is what I love to do, and I have a hard time sitting still. So I've been coast to coast to coast, Alaska, Pacific Northwest has been amazing. So many waterfalls and mountains to climb out there. It's just amazing. So, and I couldn't do any of that stuff if I was a full-time employee at a permanent job. So, yeah, I've loved it.
Well, we are grateful you did, and we are so honored to know you. We've been blessed to work with you, and you are a superhero. And just thank you again for all you do for so many and taking your superpowers on the road, and just honored to know you. And thank you for being our superhero.
Of course. Of course. Thank you for having me on this.
Okay, bye bye.
Bye.